Hey everyone, my name is Dr. Galatia Strong. I'm a physical therapist who got 100% on my boards exam, and this led me to found SPT with me, which is an NPTE prep platform. If you enjoy what you see and you're studying for the NPTE, check out our courses at sptwithme.com. Now for what you're actually here for, let's talk about Broca's aphasia. We are going to break this down much more, but Broca's aphasia is an expressive language disorder that affects a way a person speaks. Now the way a person speaks, like how loud they're talking or their enunciation or what they say, that's what we're going to break down in this video. Some other names that this goes by includes nonfluent aphasia as well as expressive aphasia, and the reasoning we call these other names is going to make more sense as we go on. Let's break down the name. Broca's. Broca's refers to Broca's area, which is a specific location in the brain, and it's the spot that's highlighted in this picture. It's called Broca's area because Broca is the last name of the person who discovered this area, French surgeon Paul Broca back in 1861. We love naming things after the people who founded it. The second word of the name, aphasia. There are multiple types of aphasia. Broca's aphasia is a type of aphasia. So aphasia in general is a language disorder that affects a person's ability to communicate. Again, ability to communicate in what way? Are we talking about volume? Are we talking about what a person says, their ability to comprehend? Well, specific aphasias have different effects. So Broca's will have a specific aspect of communication affected. Where exactly is Broca's area in the brain? If you want more information about what a Brodmann area is, check out our What is a Brodmann area video. Brodmann area 44 and 45 make up Broca's area. These are located on the left side of the brain, specifically at the frontal lobe in the posterior inferior frontal gyrus. The main and most common function that we talk about with respect to Broca's area includes spontaneous speech output. And what that means is if I want to say, I want to eat that piece of cake, I can physically jet out the words, I want to eat that piece of cake. Other functions that we just don't normally discuss as often with Broca's area includes language comprehension. This function is often more associated with Wernicke's area, a different part of the brain. Broca's area is also involved in how we move our hands, which should make sense since when humans talk, we really like to use our hands. Understand there is some involvement. It's not completely responsible for this. Lastly, it's also involved in sensory motor learning and integration. So this is just a fancy way of saying essentially the process of improving motor actions by refining how our brain processes sensory information and then is able to generate a response. But once again, the most common function that we discuss is the spontaneous speech output. So this is what we'll really dive into when we talk about the effects of Broca's aphasia. Broca's aphasia is due to damage to Broca's area. So everything that we just talked about, it must mean that there are deficits to these functions. But for the sake of simplicity, let's just talk about the main function deficit. Deficits in spontaneous speech. So let's talk about what this means. Effortful speech. So speaking is going to require a lot more effort. It not only feels physically really hard for the patient to say it and get it out, but as a bystander, the person who this patient is talking to, they can also hear the amount of effort it requires to say the word. For example, if I want to say the word cake, this patient or this person might try to say it like cake. Word finding difficulties. A person really struggles to find the words that they want to say out loud, and as a result, the speech can be a little bit more slowed down or really slow. Now, for example, just like the last one, I want to say the word cake, but because it's really hard to find in my brain the word to say, even though they can think about the word, but just saying it is a little bit challenging, it's going to take a bit of time, and it's going to sound like cake. Grammatical errors. Small words such as the or is or that, they are often left out, and as a result, we have poor grammar, so we talk often in short, incomplete sentences or even single words to get that idea out. To give an example to bring all of these together, if Broca's area is not damaged, I can say, I want that piece of cake. But if Broca's area is damaged, it might sound like, I want cake. In this example, I've covered all of those deficits listed earlier. You could tell the way I was saying it was a bit strained and labored, like I'm really trying to get it out. I couldn't say all the words that I was trying to say. It wasn't a full sentence. I missed some words like that as well as of. And furthermore, I took a bit more time than I would normally to say those words. Let's go over some misconceptions about Broca's aphasia. Understand that a person does know what they want to say, but they have extreme difficulty in being able to express those thoughts. It is not a comprehension issue. A person is mentally there. I kind of like to compare it to the tip of the tongue phenomena. Think about when you've been trying to think of the name of a movie or a restaurant or someone's name, but you just can't quite remember it, but it's on the tip of your tongue. So, for that period that you're thinking about it, you're not speaking because you're trying to think about it, but you eventually get it. It's kind of like that. This person's comprehension is fine. Mentally aware of what I want to say. The speech is the same. For example, how loud your voice is. You're not slurring. It's the same. Now, the severity of Broca's aphasia does have some impact in how the person talks, in the sense of how labored and how much effort they require to put into saying the word, like cake. Remember, it could sound very strained, like cake. Or it could be just like they sounded before. I've seen patients on both sides of the spectrum. Someone can sound incredibly labored, but another person with Broca's aphasia could sound totally like themselves prior to having the area damaged. It's just that the words, though, that come out are not grammatically correct, although it would make sense for the situation. Now, the last one is a bit of what I just mentioned, contextually correct. So let's say someone asks you, what do you want? And you want to say, I want that piece of cake. But again, you say, I want cake. That is contextually correct. It's not like I responded saying something random like stairs to the left side, and even if I said it slower, it's still not random. Now, on that note, it's quite often that people with Broca's aphasia say a response of yes or no, or yes and no, incorrectly. They mean to say yes as a response to your question, but they mean no, and vice versa. Once again, it is an appropriate response for the situation, but this person just could not find the right response. I want to go back to the slide. Other names that Broca's aphasia is called. Number 1, nonfluent aphasia. To be considered fluent when we speak, we need the ability to communicate ideas easily, smoothly, with an appropriate speed, and without constant pauses or hesitations. So clearly, all of these are affected with Broca's aphasia. So it is non-fluent aphasia. It's also called expressive aphasia. We have trouble expressing what we want to say. So it's expressive aphasia. If you feel like this video really helped to break down what Broca's aphasia is and it makes sense, check out our courses at SPT with me when you're studying for the NPTE. Check out this reference for more information.